Okay, so kia ora koutou, my name's Kerri Moran and I'm the Community Strength and Balance Manager at Harbour Sport. So we're one of 17 lead agencies across New Zealand and we hold the contract for the Community Strength and Balance program in the ADHB and WDHB. However, today I will be talking also about Counties Manukau. So today I'm going to be talking a little bit about how to refer to the different programs, but also what individuals can expect from attending or participating in the program. So how to refer to Strength and Balance. So you'll see up here it's through an e-referral. So under falls prevention, either community group or the falls prevention Inhome. So with the referral, clinicians are encouraged to do the timed up and go, as Nairi did mention, and also the tandem assessment as well prior to referring a patient. Oops, jeepers. Bit eager. So I'm sorry, this is a very busy slide because there's actually two pictures within here. So this is, as you know, the Auckland Regional Health Pathways. As Nairi and Shankar have mentioned, it is under falls prevention under older adults. Within this, you can see the in-home strength and balance service, which is for high risk of falls. And if you click on that, and the little shot down the bottom there actually shows, it'll take you to the criteria there as well. And of course, if you click on the community group, it'll also take you to the different DHBs and the criteria. So the criteria for the in-home strength and balance, as you'll see there, it is for 75 years and over. For Māori and Pacific, it is 65 years and over. And of course, as both Nairi and Shankar did mention, talking about the falls risk screening questions there too. So those that will respond positively to any one of the following. I'm only going to briefly touch on these because, as I mentioned before, they are up on the Health Pathways site, but that they have the cognitive ability to participate in a strength and balance class, but they can obviously have family and carer support to practice the exercises. So like any referral, they need to be motivated and willing to participate, and particularly in the strength and balance program and have consented to a referral. With the in-home program, it is for those that are too frail to access the community group program safely, and that's indicated by the things below there around having to use a walking aid indoors, that they're receiving personal care package, and so on. So in terms of the exclusion criteria, that they're wheelchair or bed bound, receiving end-of-life care, or have a terminal illness with less than 12 months. Also, just to mention as well, so new complex frailty issues that require addressing by a GP or a DHB funded service prior to commencing the program. So as mentioned before, this is done through the Care Connect e-referral. So what a person can expect from the in-home program in the ADHB area, it's a 6-month program. So the patient will receive a physical assessment, an initial physical assessment with a physiotherapist, and it's an individual. They'll receive an individualised program which they will complete 3 times a week to get the most benefits. They'll also receive 5 home visits from a physiotherapist and or also a therapy assistant over this 6-month period. Again, like the home visits, they'll also receive other support, which is the phone calls. With the Counties Manukau area, it's a 6-week program. Again, they will receive an initial assessment with a physiotherapist, and the physiotherapist will write them a program which they will complete, hopefully, three times a week to get the most benefits, as I mentioned before. What differs here is that they'll have access to a community health assistant if they require support to complete the strength and balance exercises independently, and they actually can have daily input if required. With this, they'll also receive, at the 6 weeks, they'll receive an assessment to see whether they require additional support, and then they can be referred to the community group or green prescription or discharged. They'll also receive a 2 and 6 week post-discharge phone call to see whether they are continuing with the exercises. In terms of the criteria for the community group strength and balance, so this is for people that are 65 years and over. With the county's Manukau area, it is 75 years and over, and for Māori and Pacific, 65 years and over. So again, as if they respond positively to any one of the following risk factors, falls risk screening questions, and also that they must be willing to participate in these strength and balance programs and consent to a referral. So the exclusion criteria is that they're too frail. If they're too frail to participate in a community class, therefore we'd sort of refer them to the in-home program. If they have a moderate or severe cognitive impairment and they don't have family or a care support within a class setting, so that's somebody going along with them to the community class to support them. So again, it's an e-referral to refer them to the program. How are we going for time? Okay, hopefully make up a little bit of time. I'll speak quickly. So what to expect from the community group strength and balance program. So the patient can expect a phone call from Harbour Sport if they live within the ADHB or WDHB areas. If they live in the county's Manukau area, they'll receive a phone call, as Shanka mentioned, the community central team within DHB will make contact with them within 2 to 3 working days to screen for suitability and find an appropriate class for them within close proximity to where they live. They can expect to attend a safe and effective class, and as Shanka and Nairi both mentioned before, that these classes have been assessed against an evidence-based criteria. The instructor will modify and adapt and progress the exercises within the class to suit that individual. There is a cost to a lot of the classes, generally between $5 and $7. There is a lot of variety in the community, and it's obviously dependent on the community as to what's available. So they can expect to improve their strength and balance if they attend on a regular basis, and I know that's something that's very, very important, is that they do continue to participate in these classes consecutively. They can also expect to be in a fun and friendly environment and supported, and that they can also stay within the same class or progress to a more challenging class over time if they choose. Now, Shanka's already mentioned this, which is the Live Stronger for Longer website, where you can order resources. There's a lot of information on here, and within some DHBs, they do have the approved strength and balance classes up there too. Just very, very quickly, and just to wrap up, this is the national campaign which was launched a couple of weeks ago by ACC. There's a lot of radio advertising, and you'll probably have more well, hopefully it'll work, and there'll be more. You'll receive more inquiries. I know we certainly have. And lastly, this is just a list of the lead agency contact details within the 3 DHB areas. So if you do have any queries or want more information, these are the people to talk to. So thank you very much.
Thank you.